Yeah, I mean, it's probably a common misconception. And actually, when I was working in the hospital as a junior doctor, people in the hospital, such as A&E doctors or nurses, would joke, oh, you'll be going to GP land soon, and it'll be easy street. But it's far from that, and the variety is extensive, and you see a lot of challenging cases. You just never know what's going to walk in through the door. And you might see, someone with a cough, and it might be very straightforward, just deciding if they've got a chest infection or upper respiratory tract infection, do they need antibiotics, are they okay? And then you just don't know what's going to come in through the door next. It might be someone with very complex social problems, and it's up to you to dissect the origin of those social problems and what you can do to help. And often it's a case of knowing what's out there, so you have resources that you turn to, other people you turn to who might have a lot more time to deal with certain problems, or it might be they just need you to listen and say that actually things they're not unwell, they're going through normal experiences and they don't need any intervention other than maybe a listening ear and perhaps a few suggestions of where they can go with their life. And then someone else will come in and you might spend 10 minutes talking about their painful knee, and just as they leave they grab the door handle and they just say, oh, whilst I'm here, and then they tell you about the central crushing chest pain they've had over the last few weeks every time they walk up a hill. And then you see go down the path of, do they have coronary artery disease in their heart? Have they got heart disease? So you have to deal with these things quite quickly and think. You can't let anything go. And often people will come with a list of problems. So then your time management is really tested. You have to quickly decide what is urgent, what do we need to deal with today, can I bring them back? And that's the good thing about general practice, is often you have time to deal with problems. So you deal with them, you don't sort everything out all at once. You acknowledge that sometimes there's a bit of uncertainty, but you're going to address that uncertainty, and you've got to be safe and maybe visit these problems over time, see how they develop, so you can know whether there's anything that needs further investigation or any management that needs to be put in place. There's certainly administrative duties, and there is a lot of paperwork dealing with results. But generally you'll have, say, 2 hours of a clinic in the morning, 2 hours in the afternoon. That's the kind of classic model. And you fit in your paperwork around it. But then you've got home visits that you have to triage and ring and assess whether you have to go. You go out to people's houses. You can earn a lot by going out to people's houses. But usually we reserve that for people who can't come in, but still a very important part. You've also got things like minor surgery. So some people will do a whole session of minor surgery, usually kind of skin surgery. I prefer to call it rather than minor, because it's important stuff still. We're always working with other members of the team in the practice. We have team meetings, educational stuff. You never stop learning wherever you are in medicine, but I think that's especially true in general practice. There's so much to keep a handle on. So yeah, lots and lots of different things people can do. I mean, a lot of GPs are managers. They're actually running their own business. So there's a lot of kind of commissioning stuff that's involved, a lot of dealing with budgets and funds, and some people are really interested in that. I've always veered away from that personally, but then if I take myself as an example and break down my working week, I do lots of out-of-hours general practice, which is very different. There's no paperwork, you don't know anything about the patient, you haven't got that continuity, but it's quite exciting, and I enjoy it because, again, you never know what's going to happen. That's the kind of clinical stuff. I also do half a day a week working in a children's hospice, which again is you're seeing kids with complex conditions that you wouldn't normally see on a day-to-day basis in general practice. So again, in that variety, and you feel you're doing a really important, if at times quite heartbreaking work. Then there's also teaching that I've been doing for, say, about 10 years, and I do that at Exeter Medical School. I've done a couple of things. What I'm doing now is problem-based learning, so the students go through a kind of real-life case, or certainly something that's very realistic, and pick out the issues from that, and then create their own questions, and then go home and independently or collaboratively, a bit of both, research the answers, come back, we present and discuss the findings. There's other things as well. A lot of people do some research, so they can either do their own research or work with other people who give them the ideas, and they go away and do the research. And you generally get protected time for that. And then there's also a big thing about appraisals at the moment. So that's another role that I have, is as an appraiser, which is the equivalent of a day's work per appraisal. And every doctor, and certainly it's a really good model within general practice, every GP will have to do one appraisal a year, and then every 5 years they'll be revalidated, so the appraisals count towards revalidation. And if you're revalidated, it means you have a license to practice for the next 5 years. So I take that role quite seriously, but actually it's very enjoyable as well. You get to have a real personal chat with GPs, whether you can discuss any problems they've got, make sure they're staying refreshed, enthusiastic, looking for signs of burnout, and that's very important again throughout medicine. So that's another really rewarding role that I have. Yes, I am, and I think there are times, and I think there are times for everyone when they question what they're doing, because it's like any professional job. There's times where it's stressful and it can kind of grind you down. So I always wanted to go into general practice, and then I got there, and you obviously adapt to working at the pace that you have to work at, and also the emotional investment that you make, and you're listening to people telling you their problems. It's quite draining. So I did get to a point after doing it for about 4 or 5 years. I was working full-time in one practice, and actually I became a bit disillusioned with general practice. I was the course organizer at the time for GP trainees. I actually stood down from that because I didn't feel it was I didn't feel I could be genuinely passionate at that point about general practice. But actually I looked at what I did, and I looked at the variety that I could apply to my working practice. And as I discussed earlier, my typical working week, I made a couple of rules for myself that I'd only work in one practice a maximum of 2 days per week, and I'd try and do as many things as possible, and chopped it up. And I think once I accessed that variety, for me, that was enough to really keep my interest and energy levels high, and I then redeveloped that passion. I think that period of almost burning out, I think it happens to almost everyone. I think, again, the appraisal process is something that's very important, so we can keep an eye on that in everyone, and really look after each other as professionals, because I think that's really important. I mean, there are other things that I thought, it'd be nice maybe to have done surgery, or some other aspect of medicine. I looked into public health for a while, and occupational health, but I think actually now I'm very happy with my working balance and the variety. So yeah, I think I'll pretty much stick with what I've got.